Hello, myself Dr. K Jha. I am Associate Director in the Asian Institute of Medical Sciences, Faridabad. And today we will be talking about drug-eluting balloon or drug-coated balloon. Both terms are used for a new device which is now available as a armamentarium in the treatment of cardiology patients. So as we know that heart disease is increasing day by day because of the more incidence and prevalence of diabetes, hypertension and smoking. And as we encounter more and more number of complicated patient, we see that patient has to undergo multiple times angioplasty, patient has multiple stents, many times the entire artery is filled with stents, the full metal jacket gets there in the form of stents. So there has always been some issues with stents which was there since the time the stent has started being deployed. First and foremost is the chances of restenosis, that is the development of blockage again inside the stent, which is in the tune of 5 to 10% of the best available stent. Then the chances of stent thrombosis, because of the metal there was always a risk of stent thrombosis which was there. Very late stent thrombosis is also quite common. So there was always a desire that if we can have a interventional therapy in which we can avoid metal and patient can be free from the risk of stent thrombosis, that would have been really nice. So of late a lot of development has taken place in this regard, and now we have got a whole range of drug coated balloon. So what does it do is that it opens the artery and it delivers the drug right at the site of blockage without having any metal implant there. So after the procedure there is no metal implant there, so patient is free from metal, so there is no chance of stent thrombosis. And another very good advantage is that if we require to stop antiplatelet because of any reason, because of bleeding or maybe the patient needs to undergo surgery, so we can stop antiplatelet without fearing the risk of stent thrombosis. Also this therapy is also helpful in patients having diffuse disease. So in diffuse disease now we don't need to make full metal jacket, we can just put stent at some point where the stenosis is very severe and the vessel lumen is large, and in distal vessel we can just do drug-eluting balloon so that we can maintain the patency of the distal vessel without metal being put. Also in case of bifurcation stenting, to take care of side branch we can use this drug-eluting balloon, because when we do bifurcation stenting with metal stents there is always chance of a stent thrombosis and stent restenosis. So these are the main advantage of drug-eluting balloon. This is a very evolving therapy and I am hoping that this therapy will greatly benefit in future patients. Thank you.